session. Today is our 1199th day. Tomorrow we are going to complete 1200 days. So thank you everyone for be the part of our journey. And today we got a guest. She's Dr. ANUJA M. Nelson. She's MD in psychiatry. She's the professor in the Department of Obstetrics and Gynecology in Venkateshwara Homeopathic Medical College and Hospital in Porur, Chennai. Now the subject here also, the subject is very, the name itself is very impressive. Infertility to infertility. I am welcoming Dr. ANUJA. Dr. ANUJA, please welcome.
I'll start, ma'am. Hope
Yeah.
my voice is audible, ma'am. Okay, good evening to all.
I'll make you as a co-host. You are going to. Are you already?
Ma'am, yeah.
Sahani sir, can you make her as a co-host? Dr. ANUJA. You already shared.
Okay.
She has uploaded. But now I am not the host now.
Okay. Okay.
Because audible, ma'am.
You are yourself. You are host.
Yes. Audible.
Yeah, you are clearly audible.
Okay. Thanks for the introduction, ma'am. Thank you so much. And okay, good evening to one and all present here. I would like to thank first of all God and my guide, Dr. Sahani sir, and the college where I work, because from here only I have got all these experiences, and this is a condensed state of, glimpse of my cases which I have seen throughout my 20 years of practice. Okay, so the topic, as you said, it is very capturing because being in obstetrics department, I have enjoyed treating every cases of infertility because people come up with various complaints, right from menstrual irregularities from PCOD to premature ovarian failure, right from 20 years of age to 45 years of age. So depending upon the clinical features, based upon the symptom similarity, I have given individualized homeopathic remedies to each one of them. I would like to insist that this is the remedy which I have given is only based on my experience and certain the keynotes most of all. So first of all, coming to the theory session, infertility. The definition for infertility is failure to conceive even after 12 months of unprotected regular sexual intercourse. We have so many reasons for infertility, right from hypothalamus to ovaries. If the hypothalamo-pituitary ovarian axis gets disturbed, or if the hypothalamo-pituitary thyroid axis gets disturbed, it causes infertility. So here I would like to quote Dr. Samuel Hahnemann's a statement: homeopathy lays only over my experience. Do imitate me, but do it well, and you shall see at each step the confirmation of my statements. This impressed me so much right from my college days. I am from White Memorial Homeopathic Medical College, and my organon teacher always says this: do imitate me, but do it well. So based upon the symptom similarity and my experience only, I have given all the, slideshare, all remedies based upon this. So next is the causes. This quote also impressed me so much. There is no royal road to a perfect understanding of materia medica, because no two persons are alike. No two mind, this thing is alike. Everyone have their own perspectives, their own outlook. So my outlook only I have given highlighted here. Okay, coming to causes. So causes of female infertility is ovulatory, then anatomical changes, cervical, and unexplained factors. We'll be discussing one after another. So I have seen many of cases who come up with infertility is because of PCOD. And here by mistake, I have put it under ovarian causes. It is from pituitary. So second major cause which causes infertility is hyperprolactinemia, which is characterized by patients come up with the symptom of galacturia, increased lactation in non-pregnant women. And the third one is hypothalamic factors. When the releasing hormones does not come from hypothalamus, the target organ pituitary gland does not work, because all the stimulating hormone has to come from pituitary gland. So when these releasing hormones or the pituitary hormones, which are the stimulating hormones, don't come or don't properly work, then the ovary does not respond or the thyroid does not respond, which eventually lead to irregular menses, and that one among the cause for infertility. And the last one is premature ovarian failure. Next comes anatomical defects, especially this is because of uterine changes. Mostly I have seen some people with septate uterus and many people with bicornuate uterus also. And congenital anomalies, that is a major cause for anatomic defects where we have very little scope. And next one is endocrinological disturbances, hypothyroidism, hyperprolactinemia, as I already said, because of pituitary causes, pituitary microadenoma or macroadenoma, that is increased prolactin levels, which inhibits the GnRH, FSH and LH, so that the ovarian response is very poor and ovulation is hindered, and thereby it results in infertility. And other causes include uterine causes like pelvic endometriosis, pelvic surgery, uterine big myomas, then uterine adhesions, all these. So coming to the investigations, the first investigation which has to be usually done, which is generally done, is USG abdomen to rule out if there is any endometriosis or adenomyotic changes, or if there are any big fibroids in the inside the inner layer of the uterus.
Madam,
yes,
I think you are going fast.
I will make myself slower, ma'am.
That will be easy for others to follow you. Okay.
Okay.
Thank you, madam. Thank you so much.
Okay.
Sorry to disturb.
Okay. So after USG abdomen, the patient has to be sent for, if the uterus and its appendages, everything, uterus is normal. The next investigation which I used to, which I asked my patients to go for is HSD, hysterosalpingography, to rule out blocks in the fallopian tube. Since the fertilization is happening in the ampulla of water, sorry, not ampulla of water, by mistake it came, in the ampulla of the fallopian tube, to rule out blocks in the fallopian tube, this is usually done. And if the tube is patent and if the os remains opened in both the sides, then the next investigation which has to be done is hormonal assay. So after USG abdomen, after HSG, the next thing which has to be done is hormonal assay, which includes the GnRH. That means including FSH and LH, follicular stimulating hormone, which comes from pituitary gland. LH, once when the FSH acts, then the LH comes and causes rupture of matured Graafian follicle. So FSH, LH, and the next thing which has to be done is AMH. AMH is anti-Mullerian hormone. This signifies ovarian reserves, how many follicles the patient has and how many times she can become pregnant, whether it is live or not. And next thing is to find out whether the prolactin level is normal, because prolactin levels and thyroid levels are directly proportional, because when the prolactin level goes up, it inhibits dopamine, which is a thyroid TSH inhibitor. So when the TSH level goes up, automatically the prolactin level also will go up. So you have to look for prolactinemia, hyperprolactinemia, whether it is under 25. So prolactin level is important. Also thyroid function test is important. You have to find out whether the thyroid hormones are within the normal limits. So it includes T3, T4 and TSH. Next, tubal patency, which I already said. The next is coming to anti-spermal antibodies, because USG, many patients I have found, USG abdomen is normal. HSG, okay, the tubes are patent. No problem with, there is no block in the tubes. And next is hormonal assay. FSH is normal, LH is normal, even AMH is normal. There is no problem with the thyroid hormones, means T3, T4, TSH. These three hormones are normal, and prolactin, that is again normal. So we have, when we have ruled out these things, then for few people, I happen to see some changes in them. That means they didn't respond to my treatment. So once when they had gone to a gynecologist, she had asked them to go for anti-spermal antibodies test, where I found few people with anti-spermal antibodies positive in their vaginal smear. So next is serum estradiol, that is under control, and next is testosterone, which is a masculine hormone, which is a male hormone. Especially it is more increased in cases of PCOD. So androgenic excess, obviously it inhibits, that is masculine state in females. The only difference between male and female is uterus. So when the uterus is not shedding properly, it means some kind of masculine nature. That is, that aromatization, conversion of androgen to estrogen doesn't occur, because all the precursor is cholesterol. All these hormones are derived from cholesterol. So when this does not take place, there is androgenic excess. This androgenic excess leads to hair growth, especially upon the chin and especially facial hairs. So this one I have found. So next is regarding, I would like to insist much upon female infertility because I have specialized on this area only. Okay, next coming to male infertility, then usual semen analysis, then transrectal ultrasonograph. So next is, so many people come even after many years of years together of infertility, primary infertility, maybe after 10 years or 12 years of infertility. So here I saw two remedies. So delays are not denials, because no worries, we have collophylum and platina, because collophylum is long-standing 11 years of infertility and platina is 10 years of. Actually, I read this from nurse repertory. So I had given to few of my patients also, other than constitutional remedies. Many I have given constitutional remedies only. But those who does not work out, don't respond to constitutional remedies, they require some other remedies which might work in another way. So keynote is taken, and based upon those symptoms only, I had prescribed these remedies. So I'll be explaining about collophylum and platina next. Then, okay, so constitutional remedies which I usually prescribe is Pulsatilla. You all know these remedies. Pulsatilla, calcarea carb, cali carb, lachesis, sepia, natramur, then silicea, phosphorus, sulfur, graphitis, thuja, lycopodium, staphylos aureus. These many remedies are usually prescribed based upon the constitutional totality. Again, I repeat, this is from my experience I am saying. So these remedies have been given repeatedly to many of my patients. And those patients who don't generally respond to these remedies, even after raising the potency from 30, we change to, depending upon the miasmatic background, based upon the symptom similarity, based upon the susceptibility, all these, the potency is raised. So from 30, then 200, if there are structural changes like fibroids or bigger ovarian cyst, para-ovarian cyst, I used to go for low potencies only. So after giving 30 potency, if there is no improvement, there is no menses, there is no conception, then generally I raise the potency. And then after giving 200 also there is no potency, then 1M, LM, all these. So generally an intercurrent will be given. So again, if there is no improvement, if I find no improvement in menses or this thing, then again, and after giving an intercurrent, if new symptoms arises, that totality will be again taken, and sector totality will be taken, and acute remedies are generally prescribed. So the next one is about the rare remedies which I have generally, I have found success with these remedies. These are the rare remedies, which includes, first is syphilinum. Syphilinum is mainly given for premature ovarian failure. So I have given many cases syphilinum as an intercurrent, because during repertory session, many people used to say, doctor, I get I get menses at variable intervals. So generally I give sulfur, there won't be any improvement. Then they say, I get symptoms on alternate months. Sometimes I take it as regular, because every alternate months they get, that is again late but regular. So I found two remedies under that. One is syphilinum and another one is thalaspi. So I had given syphilinum only to many of my cases as an intercurrent or as an anti-miasmatic. Since there is no life at all, or if they have any history of abortions, generally I go for, and if the patient is very hot, if she doesn't respond to any kind of treatment, any constitutional remedies, then obviously the first remedy of choice will be syphilinum. So in higher potency only, no sources are generally given in higher potencies, that is 1M and above. So after giving syphilinum, the next remedy which I usually give is if the patient complains, because some people will say after asking their sexual history, if you have if you have sexual desire, yeah, it is there. You attain climaxes, your orgasm, it is present, yeah, you enjoy, okay, it is there. Then they say about, some people tell about the seminal consistency also. And some people say that it is not getting retained. So when it is getting discharged the next day or so, the remedy is, because I have found much success with natrum carb. So natrum carb is a remedy which is generally given for non-retention of semen. If the semen is not getting retained and it is passed and it is ejected, so the remedy is natrum carb. Next coming remedies, this belongs to again carbon family, eupaeonum, belonging to carbon family. Here I read from Boric, it is given for chronic tubal disease. Wherever we find tubes, there it acts. Then only I had a thought. So obviously, definitely it will act for tubal blocks. So no matter whether it is right or left. So because I have given for many cases cactus, I had given sepia, I have given. Because the pathology of cactus is totally different. It is in Boric line will be given toxic goiter, because I told you increased levels of TSH. What it does, it inhibits dopamine, which is a prolactin inhibitor. So what happens when the TSH level goes up? Obviously, automatically the prolactin level also will go up. So when suitable remedy is given, the TSH level goes down and it increases the thyroid hormone levels. At the same time, prolactin level also will go down. So there I found, so cactus is one among the remedy which is given for tubal block. Other than cactus, based upon the symptom similarity only, again disease, because deserted feeling, hopelessness. Many people have come and told me, doctor, this is my last thing. Here, from here onwards, I will not go to any doctors, because everyone, they have lost hope. They are telling already you are 35, already you are 40, already you are 45. There is no hope at all. Eventually, definitely you have thyroid issues. So definitely it hinders with ovulation and other things. There is no fertility, there is no scope at all. For such people, I used to give cactus. For few patients, it has worked out well. If there is no improvement with cactus, I go with Upeon. And few people have got pregnancy with Upeon also. Okay. So the next remedy is borax. Borax, as I already said. So one among the cause for infertility is acridity of vaginal discharge, which kills the sperm. So anti-spermal antibodies. So some people will come up with, because the uterus will be normal, ovulation follicle. If we send the person for ovulation study, again ovulation has occurred, so fertilization would have happened. So no matter, some people end up with chemical pregnancy because of luteal phase defect. Other than that, so borax is mainly, I just told you, it is given for anti-spermal antibodies. So when the cervical smear has anti-spermal antibodies, then the remedy is borax, because the acridity of the vaginal discharge kills the sperm. So the next remedy is, and sanicula also runs close to borax. Next remedy is coneum, and I have got enormous success with coneum. Around, I will say, more than 75% of cases are with coneum only. Generally, we give coneum for widows, for this thing, mainly for bachelors and spinsters. And here, coneum has worked out very well, because from Inventons Uterine Therapeutics, I found coneum in one rubric stating amenorrhea from ovarian troubles. One remedy is coneum, second remedy is podophyllum, and the last one is epis. So I wanted to try with coneum. So from this past 20 years only, I am saying, I have given several cases coneum, and all, for most of the cases it has worked wonderfully. Coneum in higher potencies only, and especially mostly it is for PCOD. And the next remedy is this podophyllum. It is again, it corrects all the endocrinological disturbances. It is mainly a liver remedy. So podophyllum also, when the coneum, I have found success with coneum. If there is no success with coneum, the next remedy which I will be giving is podophyllum. That is again based on symptom similarity only. And next is a very big constitutional remedy, I can say, but it is generally not, it is not included in among the list of the polycrust. It's an unstable salt, and the salt is calibro. So if you read boric, you can find many clinical conditions there. This is a remedy of hypothyroidism. This is a remedy of pan-ovarian cyst. This is a remedy of diabetes mellitus. Then this is a remedy of convulsions. This is a remedy of acute hydrocephalus. So various, many this thing. So based upon the concomitants, so here convulsive attacks 2 to 3 days before menses. Based upon that, I have given calibrum to many of my patients, because the pathology of insulin resistance is the pathology of PCOD is insulin resistance. So again, if there is, based upon the clinical features, endocrinological disturbances, next to podophyllum, the remedy which I usually give is, if the patient has a high level of sugar, or if the patients come up with increased level of even Hashimoto's thyroiditis, there also calibrum has given good results. Then next to calibrum, anantharum. Anantharum is generally we think of anantharum only for skin complaints, but I found in nerve repertory for atrophy of ovaries, anantharum is the remedy, and eupatorium purpureum. This is the main remedy. We generally give eupatorium purpureum for diabetes mellitus and diabetes insipidus. So what is the pathophysiology of diabetes mellitus? What happens in diabetes mellitus? Insulin resistance. In PCOD, insulin resistance, same pathology. Again here, so it has to be much, because very few people only I had given eupatorium purpureum, still has to be explored.
Madam,
yes,
your slides are not moving.
Yeah, okay, ma'am. Okay, ma'am. Because I was telling about, I was explaining about these remedies in detail. Okay, next to eupatorium purpureum.
Yeah, now it's okay.
Yeah. Thank you. So these are taken from nerve repertory, these are taken from boric, the Nallen's keynote, all these. So I would like to summarize few points where I found only one symptoms very, what to say, which is very catchy, and I learned many things from this only. So natrum carb, as I already told, it's a remedy where infertility results from non-retention of semen. So I found a line. This is from Ner Repertory. It prevents false conception. It prevents false. There's a spelling mistake. Sorry. So prevents false conception. And next remedy is this is. I think we doctors know about the difference between infertility and sterility. Infertility is inability to conceive. Sterility is there is no chances for conception at all. If there is no ovaries, if there is no uterus, if there is no fallopian, because now technologies have been advanced and we have surrogates also. But generally speaking, like congenital anomalies, I can say, or hormonal anomalies, all these. So the remedy which I usually give for non-retention of semen is natrum carb, and I found this like it prevents false conception, that is chemical pregnancy. Because many people come up with pseudocyesis, that is false pregnancy. They say my stomach is distended, I have some kind of pulsation in my stomach, I have giddiness, I have vomiting, I feel like eating some indigestible things. Like chalk, pica-like symptoms, all they say. For such cases only I had given natrum carb, and it has worked out very well, because once when we asked them to, menses would have got delayed, one thing. So amenorrhea is there. Second thing is we asked them to go for USG abdomen. So there is no sac found, there is no decidual reaction. So next thing is beta HCG, urine analysis first of all. So urine, there won't be any positive results. UPT is negative. They don't get compromised very easily, because it's a matter of very sensitive issues. So then what we generally do to confirm pregnancy, again beta HCG, it comes out negative only there. So for such cases, only to those people, if they present, if they say that there is no retention of semen, for them I give natrum carb. Next is natramor. So natramor is again a constitutional totality, because in those days, generally, in those days, I mean, because anything which is given as a contraception is given for conception, like cures like. The one which is given as a preventive will act as a therapeutic one. So I found in Hippocrates days, during those days, cow dung with ruta, with egg white and sodium bicarbonate, that is our natrum carb. Sodium bicarbonate it is, with salt. It is made as a paste and it is kept in the vagina, so that it prevents the access of sperm towards the uterine cavity. So when I found this only, I came to know, because generally we all know, but when we water is generally for plants we water. There is no in salty areas will the plant grow? No. What happens when we bath ourselves with salted water, the water which contains more salt, definitely the hair also will fall away. So that concept only here also. So sterility with too early and too profuse menstruation with repugnance to coition. But I found one symptom in natramor stating, even though there is repugnance to coition, they feel very much cheerful after sex. There I found only one remedy. The remedy is natramor. So they say they have aversion. That is, sexual history is again important. Case taking is very, very important. Among them, the concomitants, menstrual concomitants, before menses, during menses, after menses, and what happens with the suppression of menses. When they don't get menses, what happens? That again is very important. And about the leukorrhea, the nature of leukorrhea, its color, consistency, whether staining pattern, before, during, or after menses, instead of menses, all these. And apart from that, mental changes with absence of menses. Then sexual history, whether they have, again already I have told this, and whether they have desire, whether they are satisfied, whether they are cheerful, or they get upset, they get irritability, or something like that. So many people they come up and say they don't wish to have sex, they don't have that much of interest, they don't feel like having. But despite what happens, they feel better. And generally I used to ask people, and afterwards, how do you feel? They say, okay, I'm very happy only after that. After that, the relationship gets tightened, the bondage increases. Likewise, so first such people only I given natramor, because I found cheerful after sex only one remedy, and the remedy is natramor. Next to natramor is sterility with depression of spirit. We all know our image is generally depressed. For male infertility, pining boys, okay, cryptorchidism, all these conditions. Then sterility from leukorrhea. Here also acridity and putridity. Again, this belongs to carbon family. It runs very close to eupion. So, but I have not given creosote for tubal block when there is severe acridity, because it is a tubercular remedy. Menses intermittent, menses prolonged, menses black. If I get such kind of symptoms, again, the nature of menses, profuse or scanty. So the remedy changes. If it is profuse, the remedy changes, or if it is scanty, again the remedy changes. Then pain, concomitants, staining pattern, odor, all these. So the next remedy is sterility after leukorrhea in women who has this is what about collophylum. So I told you delays are not denials, because we have collophylum and platina. And this platina here we have already seen leukorrhea in especially children, leukorrhea because of atonicity. There we find calcarea, collophylum, millefolium. And here from nerve repertory I have taken this sterility after leukorrhea in women who had got married 10 years, after 10 years of infertility. So for such people, you can think of collophylum. It's mainly a female remedy. So depending upon the symptom similarity, you can think of collophylum also, don't forget. Okay, next is sterility due to profuse menses and too early menses. Again, here the time varies, quantity varies. The duration of menses varies, the quantity of menses varies. And for such people, you can think of sulfur. Even for all hormonal imbalances, functionally, if there is no structural involvement, if there is no structural changes at all, you can think of sulfur. Okay, next is sterility with late menses and late profuse menses, phosphorus. And next, sterility, because one more remedy we have for this one, I will be discussing. I will be telling about the most important peculiar symptom of that remedy when the next slide comes. Okay, okay, so sterility with late and profuse menses is phosphorus. Next remedy is agnus castris. Here, I have found many people, I give constitutional remedy, no improvement. Then they say, madam, I am not getting menses, nor I have desire. So first, because many people have told, I used to think, why these people are not having sex drive? So probably because of lack of estrogen, progesterone, lack of follicular stimulating hormone, because of hormonal imbalances only. All these are. For such people, I used to give agnus castris. We generally give agnus castris for males. It's a male remedy actually. When you find masculine characteristics in females, you can think of agnus castris, because in those days, this when I was studying in college, my teacher used to say, every saint has a past and every sinner has a future. Every saint has a past and every sinner has a future. Those who were Valmiki, you people must be knowing. So every saint, once they are like sinners only, they turn after a period of time. So once they were much indulged into sexual act, they turn themselves after a period of time. Because in those days, Chinese monks, they used agnus castris seeds, it seems, for suppressing their sexual desire, because they are monks in teenage or in young age, obviously they will have sexual desire, and to suppress that, these people used to take agnus castris agnus castris, it seems. So those which suppresses the thing have the power to enhance it, right? So the one which is given in the crude form suppresses, in therapeutic dose it increases. So that is the characteristic feature of agnus castris. So sterility with no menses or sexual desire, and for such people the remedy is agnus castris. Next is sterility with profuse menses and tendency to miscarriage. Again, you all know about Aero. You all know about Apollo also. Apollo's mother, she has hold the heels of the Apollo, and she has dipped him in the river filled with the Aero, which has Aero, because Aero is a plant which is said as if it is taken, it gives an immortal life. I hope you understand. So for immortality, for not having death, to prolong the longevity of life, this millefolium is taken. That is, Aero is taken in those days. So here also it belongs to compositive family, if my memory is right. So again, generally it is given for mechanical injuries, tuberculosis after mechanical injuries to the chest. So for such complaints, millefolium is generally given. But I found this also here. So it's a very anti-hemorrhagic remedy. Sterility with profuse menses and tendency to miscarriage. The remedy is millefolium. Okay, next is about, this is about failure, sterility, total failure only. There is no chances of the patient to get conception at all, I can say. So the remedies are sterility with atrophy of ovaries. One remedy is ananthrum. Ananthrum. Sorry, that's a spelling mistake. And the next remedy is calibrum. I told you this is given for insulin resistance. This is given for hypothyroidism. This remedy is given for convulsions. All these are clinical rubrics only. When you go inside and learn the pathology, you will get good amount of this thing from that. Okay. Next is again this. Already we have discussed Natromur and Agnus castris, they don't have any sex drive, but this is entirely different. They have excessive sexual desire. And one more remedy which I wanted to say along with phosphorus also, falls in this only. I'll be discussing about it in the next slide. Okay, so sterility with excessive sexual indulgence, that is again calibro. So sterility with uterine atony, gossypium, because it's a powerful emmenagogue. It is written in boric as it's a powerful emmenagogue. So gossypium. Then sterility with atrophy of breast and ovaries, iodome. We all know about iodome. Except thyroid gland, all the glands are dwindled. Except goiter, except hypertrophy of thyroid gland, all the things are much shriveled and dwindled. So for such people, thin, dark, all these. So if the discharge makes a hole in their linen, in their cloth, then you can think of like creosotum. You can like borax. So you can think of this remedy also based upon the symptom similarity. Next is infertility with atrophy of breast and ovaries. So atrophy of breast, atrophy of ovaries. So atrophy of breast and ovaries means what? There is failure of gonadotropin releasing hormone. So the target organ is breast and ovaries. If estrogen does not come, obviously there is no enlargement, there is no hypertrophy, there is no shining, there is no complexion increase in the beauty of this thing, because females get their beauty, charm, complexion, all the things from estrogen only. So when it is lacking, all these will go down. So when there is atrophy of, the atrophy of breast and ovaries, we have coneum, we have iodum. Iodum we have already discussed. Coneum also has been discussed. And next remedy is Sabal cerulata. That's a very wonderful rubric in under Sabal cerulata. Only few of my patients I have given Sabal cerulata, because in this 20 years I have got only 2 or 3 patients with the main keynote symptom of Sabal cerulata. I can say I have found this symptom from, I think from neuropathy only, because in boric it is not given, and I don't find sorry, because it is not given in Allen's keynote also. One breast smaller and one breast larger. One breast smaller and one breast larger. That is the point of Sabal cerulata. So few of my patients have come, because in my initial days of practice, I was not knowing. I was thinking about iodum only. Iodum, barite iode, kali iode, such kind of syphilitic remedies only I was thinking. Then only after reading why these patients are not improving, why there is, because then and there only I used to get those people come and say, ma'am, there is no improvement. It is still the same. One is smaller and one is larger. Same way, there is no improvement at all. Then only I came to know, because it is generally given for prostatic hypertrophy. If it is given for prostatic hypertrophy, definitely our females, the prostate, the gland, the organ which represents male prostate is uterus. Definitely it must be having action on uterus. If it acts upon the uterus, obviously female reproductive organ, accessory organ, breast, there also it will have, it should have action. Thinking that again, so Sabal cerulata is a wonderful remedy. Then only I got this point: infertility with atrophy of breast and ovaries. The remedy, another remedy is Sabal cerulata. So Chimaphila ambulata also you can think, those who have big breasts. So there Chimaphila ambulata works, because it is given for diabetes mellitus. So if it acts for diabetes, if it has the power to reduce the sugar levels, what does it say? Obviously endocrinological pathology is there. So obviously it has the power to increase or decrease the size of breast also. Okay, so definitely it will act for infertility issues too. Okay, next is about infertility from acid vaginal discharge, natropause we have discussed. Then infertility from weakness. Okay, like as we have discussed already, from 10 years of infertility, caulophilum. Merck again anti-syphilitic remedy. Sepia again constitutional one. Those who have prolapse of uterus, then displacement of uterus, I can say, aversion to sex, like. And next is Silesia. Again, it's a crude, inactive. It's a dull one. So Silesia, and which is this thing, complementary of Pulsatilla calcarea and so on. Then next one is again caulophilum comes. Leucorrhea, which prevents pregnancy. That I found only calcarea there, not calcarea, caulophilum. Sorry. Next is again I wanted to search a few more remedies. So there I got with abdominal pain, sterility with abdominal pain during menses, Phytolacca. But I have not given Phytolacca throughout my cases. So I cannot say how far it has acted and how far it works. I cannot say. So when I come across these rubrics, I found Phytolacca there. So with abdominal pain, sterility during menses, abdominal pain with sterility. That is Phytolacca. Then again, vegetable analog of this thing, mercury. Depression of spirits with, again, as we have already discussed about aurum. Then from Leucorrhea, caulophilum and creosotum. Creosotum we have acridity and putridity. Dark discharge means irregular menses. Again, symptom similarity. Next is again the same one is repeated here. 10 years of Leucorrhea, infertility. Okay. menses too early, too profuse, late, at variable intervals, all these. Okay, there is sulfur. Again, menses late or profuse. I think the slide is getting repeated. Yeah. With tendency to miscarriage, millifolium, then mucus. Okay, so there is mucus discharge from the vagina, which prevents fertility. Natrum carb, you have the eupatorium purpureum because weight tonicity of ovaries, ananthrum atrophy of ovaries. I think we have discussed this. Calibrom, then with excessive sexual indulgence, calibrom, then uterine atonicity, alectris farnosa. Again, this is a remedy which is given for anemia. Also, this is given for uterine displacements. So, gossypium, powerful amino. Then, sterility with excessive voluptuousness, phosphorus. Again, our bigger remedy, the one who thinks bigger, and very much bigger, and others are very, very small, very low to her. That remedy, nothing other than our platina lady. So she's more superior here also, because for colophilum, we have 10 years of infertility only, 10 years of infertility story, whereas platina has 12 years. Okay, again, she's superior here also. We'll go to the next one. Okay, so this is, I wanted to say a few things about the rarest of the rare remedies from my clinical practice only. Again, disease. So first one is euphrasia. Have you ever thought why euphrasia has scanty menses? Why euphrasia has scanty menses generally? What is the pathophysiology of scanty menses or oligomenorrhea? Oligomenorrhea is mainly the most common pathology which we used to see is PCOD only. Okay, so for few people, what they used to say is, I remember a case actually. She is around 35 years of age, primary, married for about 5 years only. I think in her 30 years of age, she got married, and after 5 years of infertility, she had come after going to many clinicians, many gynecologists. She had approached us. So there we found only other than scanty menses, nothing I was able to realize it, because I didn't get any concomitants, concomitants I didn't get. So only thing what she said was very scanty menses. I have got half a pad only. I used to this thing it used to get that, and maybe few spottings. I used to think of magnetis polyambo or astralis during that time, and most often the remedy which usually strike us is sepia. So menses very scanty is usually I thought of sepia only. So I made a mistake. I had given sepia only, thinking constitutionally it will work. So after giving sepia 30, no improvement. 200, no improvement. 1 no improvement. Because she was silly only that time. Then when days passed on, she was under my treatment for at least 1 year, I think. So after that, there was no this thing. No, there is no much flow. So rarely, again, half a pad only got wet. There was no much discharge. Then what she said was, she complained of what to say, conjunctivitis like symptoms. There was burning sensation in my eyes, something hot air is escaping out. Recent days I used to feel this. Whenever there is no menses, I feel like hot flashes I have. What I thought was, okay, this is because of progesteronic excess. So progesterone has thermogenic effects. So it is again a common symptom. Nothing I found there. So then only I came across a rubric, amenorrhea with ophthalmia. There I found euphrasia. Amenorrhea with ophthalmia. There I found euphrasia. Then I wanted to learn more about euphrasia. Then when she came, when she said about burning feet, burning soles, all these, I thought of sanguinary, probably premature ovarian failure or premature menopause like symptoms. Then I had given sanguinary there also. I failed. Then I gave Medornum, syphilinum, nothing worked out. Then what happened? I asked her to go for, she never complained of polydipsia, polyphagia, something like that, like sugar symptoms. So then what I did was, I asked her to go for a sugar level check. It was very high. So, okay. So it was very high. And after giving, I didn't give euphrasia that time also. So I was giving again some set of symptoms I got based upon the sector totality. Some remedies have been prescribed, cycesium, like drops have been given, and that too didn't work. And finally, I thought she didn't get menses also. She neither became pregnant nor she got menses. There was no significant story about her sexual history. So nothing guided me. Then I wanted, then again I recollected. Again I thought, okay, why don't we give euphrasia again? Euphrasia, like Then only I had given euphrasia in higher potency. 1 or 10, I don't remember. I had given for only one patient. That is, I cannot say, I cannot generalize things. So that's why Kent has rightly said there is no royal road for a perfect understanding of materia medica, because my view is different, my outlook is different, and this thing is different. So I thought of giving, so that sometimes if it works out, okay, it's good only. So thinking that way only, I had given euphrasia and menses. She got her menses after 6 months or so. She got her menses. The wonder is her sugar levels also got dropped down. So she didn't become pregnant, but she's still under my treatment. So we'll see. So next remedy is Asterius rubens. This is again for few people only. I cannot take the statistics report because I give only for few people. And when other remedies have failed totally, when there was no success with previous medications like constitutional totality after giving intercurrent anti-miasmatic approach, when there was no improvement at all, only then I had given these rare remedies, like based upon few symptoms, few rare PQRS, such symptoms. So Asterius rubens. Here, when I was searching for concomitants, again the patient did not have regular menses. PCOD again, we think of Asterius rubens mainly for mammary carcinoma, right? So if it has action upon breast, it has action upon uterus also. If it has action upon uterus, obviously some kind of hormonal changes, definitely. So, so what I did was, the common name of Asterius rubens, you all must be knowing, this thing, starfish. It is also called sugar starfish. So then I was wondering why this is called sugar starfish. What action it has, why these people are getting rashes at the approach of menses. Even in Dulcamara, Sorinum also, we have same symptoms. Rashes appear before menses. Dulcamara also we have. So there also, Dulcamara also have amenorrhea after getting wet, after getting cold. So on exposure to cold, there is suppression of menses. So I didn't go much into Dulcamara, but I got struck with this Asterius rubens. I was thinking why these people is not, why these persons are getting pimples at the approach of menses. Then only after reading, we all know, when the estrogen level falls, estrogen is the hormone which gives us charm and beauty. So when the estrogen level goes down and the progesterone level goes up, what happens? Automatically, this sebum secretion gets clogged up there. And that results in closure of this, the sebaceous glands control get lost, and there occurs accumulation of this thing, and that's why this pimple occurs. So for a few people, I can say 3 or 4 only. For them only, I had given Asterius rubens, and that also brought menses again. Because they had, when we take the menstrual history, they used to say, when at the approach of menses, I used to get rashes. So generally, we think of Dulcamara or Sorinum or this thing only. But there I found Asterius rubens. Also, here we have Calibrome also, because acne rosacea, this thing, this acne is a symptom of PCOD again. So there also Calibrome acts. Eugenia jumbos, you must be familiar with Eugenia jumbos. Clark has said the most important remedy which acts wonderfully for acne vulgaris is, acne is again a symptom only. So acne is, Calibrome. When you're given 30 potency, definitely it will go, but that has to be given for so many, days together. Next is Eugenia jumbos. There are also rashes appear before menses, then Dulcamara, and our asafoetida. It is a hormone, it is a remedy which is usually given for galacturia, agalactia, or decreased amount of, milk. So what is the pathophysiology of asafoetida? Because when there is low secretion of milk only, we think of asafoetida to increase the milk secretion. So anything which increases the milk secretion hinders with what? Ovulation again. So when the woman has much amount of, because lactational amenorrhea is a very common one. When the prolactin level goes up, it inhibits GnRS. So FSH/LS will not come. So eventually that fertilization, ovulation gets hindered. So here also then I thought of asafoetida, because it was a case of pituitary microadenoma. She never responded to calcarea cord, tuberculinum, basilinum, many remedies I have given, Tuja, all those. She didn't respond, and that girl, infertility for 7 years, I think. 7 years. Once she conceived, that ended up with tubal block. There also it got failed. But that too, again giving asafoetida only, there was good improvement, because despite giving all these remedies, there was no improvement with the secretion of milk. Neither she became pregnant, nor there was any improvement. Then only I thought, okay, so pituitary microadenoma is there. There is increased amount of this thing. Milk secretion in non-pregnant women. So why don't we give asafoetida? So I thought of giving this one. I gave, and the milk secretion stopped. Only after the stoppage of milk secretion only she conceived. So that only I told. She conceived, but it ended up with ectopic pregnancy. Okay, next is about our fungus, Bovista. Again, Bovista is our puff ball, dropsical condition, swelling, dropsy, cystic changes, pan-ovarian cyst. Wherever there is swelling, yeah, eventually, obviously it hinders with this thing, even PID, pelvic inflammatory disease, sexually transmitted diseases, where you find excess amount of discharge, like swelling, all the inflammatory changes. There you can think of Bovista. Again, very rare, this thing only, cases only for them. Okay, this is about, I think we are approaching time. So shall I rush up little? Okay, say case of complex ovarian cyst. So here, this is a case of complex ovarian cyst. Actually, this is some years back. I'm giving the one which I have evidence only. I am giving here. So it's a right complex ovarian cyst, 8.7 into 5.3 centimeters. Okay, right ovarian cyst, 8.7 centimeters into 5.3 centimeters. That means it comes 15 inches is like this much, like more than an apple size. So she was around 40. Little down. 27 June it was taken. She was around 30 years of age. Sorry, excuse me. So the remedy which I had given is there was good success. Next slide. Next one. Okay. It's not moving. Excuse me. Next one. Go to the next one. Okay, so left polycystic ovary and the right one is next. Now we'll move. Okay, so here she became pregnant, the same lady in 411. So the remedy given was single viable pregnancy. So the remedy given was, first I had given Conem, there was no improvement at all. This I have taken from nerve repertory only. The remedy given was calibro. A cyst measurement taken in a line from the iliac crest. From the iliac crest, a measurement is taken from the ilium of about 10 inches size. So I thought, if it has the power to reduce 10 inches, it is only 8.5 centimeters. Why not? Definitely, this calibrum will take care of this cyst also. So calibrum was given, but I had given calibrum at least for 2-3 months. So eventually that got reduced and she became pregnant also. This is one case. And this is another case of Hashimoto's thyroiditis associated with infertility. She was around 34 or 35 years of age. You can see the thyroid levels, 193 on May 5, I think. It was on May 5, 193. Next. After getting the consent only, I have displayed this one. Okay, next. I can zoom this. Okay, this is on 29.5. That is on 9.5. This is on 29.5. The TSS level has come to 61. And next is 26. From 5 to 26, 14. Next is 13.7. So from May to July. May, June, July, 3 months. Now it is 8.3. And the remedy given was not or calcarea, not or spongia, not or iodum, not or bromium. Usually given remedies all failed. So I found a remedy which is a combination of calcarea fluor and silicea, because she developed some goiter-like symptoms also. There was multinodular goiter, little bit improvement was there. Nothing worked out. As I told, calcarea, sepia, bromium, iodum, all these, nothing worked out. And the remedy worked out was calcarea silicofluoride. And the remedy is Lepisalva. Okay. So affections of the glands, pre-ulcerative stage of carcinoma. You can read from Boric itself. So this is the remedy. And this is again a case of right, and there was a complex cyst of ovary, that is calibrum I had given. This is again a
Madam,
time is
yeah, actually
okay.
we have a questionnaire.
Yeah, ma'am, please.
So
yes. Okay, over, ma'am.
Okay, because
yes, ma'am. Completed, because I was much also. So we'll okay. Please, ma'am, you can ask questions.
Participants, please raise your hands for asking question to Dr. Anuja. Please.
Thank you. Yeah.
Anyone? If there is no hand raised, we will continue. I think.
I have completed, ma'am.
Actually, I thought Dr. Hariharan. Dr. Hariharan. Okay. Shabina. Okay.
Doctor, I not fully heard your class.
Okay, sir.
I attended only half an hour. But I want to ask a question. Is that for low AMH,
Yes, sir.
how will you treat such cases?
Okay, sir. Okay, sir. So, based upon the minimum or constitutional totality is my usual prescription style. That is my usual prescription. But apart from that, when this is not working, as I already said, anti-miasmatic remedy. And the most often used anti-miasmatic remedy is syphilinum. Next to syphilinum is only Silesia, Lepis alba, where if I feel like the problem is with the endocrinal glands, that is ovaries only, iodum, corneum, again same podophyllum, but podophyllum has worked wonderfully. Those which are vegetable analogs of mercury has acted in a wonderful fashion than any other remedies, I can say.
Good. Very good.
Thank you, sir. Thank you, sir. Thank you so much, sir.
Okay. Very good class.
Thank you, sir.
Okay. Blessing of IFPH. Very good. One day you will be known as a very good gynecologist.
Thank you, sir. Thank you.
Specialized in infertility.
Thank you.
Is it so, Ajini?
Yes, of course. Even I am so proud about her because she is from my college.
Okay.
From White Memorial, right?
See,
Oh, yeah.
Mullappumbadi ഏറ്റുകിടക്കൻ കല്ലിന് ഉണ്ടാം സൗരഭ്യം.
ठीक से सुने नहीं दिया सर. मेरा यूजी तो वाइट मेमोरियल से ही था, लेकिन मैंने पीजी कर ली फ्रॉम जीडी मेमोरियल से. ऐसे ही मुझे सारे सर को पहचाना मैं. और सॉरी. So the college which gave all these experiences, Venkateshwara Homeopathy, where I work in Chennai.
Okay, doctor. Good.
Thank you, sir. Thanks a lot.
And
Happy.
Again, you come with more cases, doctor. We want to see the cases and the exact way of treatment by using minimum and constitutional remedy and miasmatic approach. That we want.
Yeah, definitely. Sure, sir.
okay, Dr. Shabina.
Good evening, ma'am.
Good evening, ma'am.
Ma'am, I am treating a case of PCOD since last 3 months. The patient is improving. I have given a pulsatilla.
Okay.
But ma'am, her menses have a little bit improved. And she's married since 2 years. And she is having PCOD complaints since last 2.5 years before marriage. And ma'am, I'm stuck up in between the case. I don't know where to go now because her menses have improved, but not that much. Scanty menses and irregular. Only it is coming on date. Otherwise, I mean, no more improvement. So what can I do more in this case to get result? Because she want to conceive. She's saying ki, yes, ma'am. And I don't know where to head in this case. I'm really stuck up, ma'am. Please help.
As I already said, go with the concomitants, ma'am. Use Minton's uterine therapeutics. It is of greater value because I'm teaching gynecology for the past 15 to 18 years. So I used to take many symptoms from neuropathy and Minton's uterine therapeutics only. So here what I would like to say is, if constitutional remedy is not helping and as anti-miasmatic remedy is also not up to the mark, then again go with leukorrhea and its concomitants, sexual history. So
Okay.
I wanted to say one remedy I told you, right? That is about cantharis. It's an aphrodisiac. It is given for both males and females. When there is low sex drive, it increases. And so there is increased sexual desire in both sexes.
So, ma'am, there is Ma'am, there is no, there is sexual, sexual desire is there. It's not that I don't have, but the thing is this, she get disappointed every time she get her menses. She get highly disappointed, irritable, and anger and she's so impatient. Every time she keep asking me why I'm not getting pregnant or when will I conceive. Since two, and she's totally now she's getting attached with me also. Somewhere I have given a pulsatilla, but I feel like more of she's calcarea. I mean, I don't know what else should I ask about in this case to her?
I think the temperament also has been changed with this thing, because Pulsatla will not question to this extent. She is, even though Pulsatla is repulsive, she will not question to, because she's a very submissive lady. So you can think of some other remedies, I think. As I said, Cantharis and Sepia, all these remedies. Apart from, if her I don't say if symptoms have got changed, again you can take another one kind of sector totality based upon the presenting complaints you can prescribe. Again, because
Can I give her intercurrent remedy because she had past history of tuberculosis?
again,
So
specialized tubercular.
yes,
You
ma'am.
can think of tubercular, or you can think
Okay.
of, as I told you, I mean, definitely tuberculum you can think.
Okay.
She's
Yes.
hot or chilly, ma'am? Also,
Ma'am, she's hot patient.
she is a hot patient. You
Yes,
can
ma'am.
syphilinum also.
Syphilinum. Okay.
Because scanty
Okay.
is again because much flow has to be, right?
Yes,
So
ma'am.
average at least the patient is improving. You can go for LM potency, ma'am.
Ma'am, I'm giving her LM only. LM
Okay.
0/1 pulsatilla, and in between I've given her 30 also, 200 1M also, and again I've started with 0/1 because when giving LM, she had the flow was improved last month, and last 2 months the flow was good, but again this month the flow has decreased. So again I start with 0/1. Should I go to 0 by some other like higher potency, 0/2 or 3?
Yeah, please. If she
Okay.
is Pulsatilla, definitely with much confidence you can go for higher potency. No problem. If LM 0/1 is not working, definitely you can go for higher one.
Because last month she has improved, ma'am, very well. Her flow was improved. Her menses got regular. But the
Hmm.
only thing was this: after 3 months, again I'm feeling I'm back to zero. Again, I have to start with same thing, same procedure. So again, I have started with pulsatilla 0/1. Today only I gave her. Asked her to start with 0/1.
Okay. Think
Potency
of cactus
pulsatilla.
and cyclamen also, ma'am. Think about cactus
Cycle.
and cyclamen. Yeah. Cactus and cyclamen.
Cactus. Oh,
After
oh.
giving another one more intercurrent, tuberculinum. After tuberculinum, you can think of these two because again, cactus is tubercular only.
Okay, okay.
Thank
So
you,
should I give
Dr.
her tuberculinum 1M one
Yeah, higher
dose?
potency. Yeah, of course. One arm only. One arm and
Okay, okay. Thank you so much, ma'am.
Thank you. And Dr. Hariharan has raised his hand again, whether he has
No,
questions.
no. By hearing that case, I don't think that it is pulsatilla. Some other, some
She
other,
already mentioned.
some other remedy. That is, it is not pulsatilla. See, maybe think about some another remedy. Maybe it may be sepia or lactis. But sepia is a chilly patient, but lactis is hot patient. And see, you have to change the constitutional remedy. Then only you will get the correct. So, but pulsatilla done, partially done, but it is a partial remedy. It is not a fully chosen remedy.
Yeah, she requires a complementary again.
So change the constitutional main prescription, you have to change it. Then you can try euphornum along with that. Euphornum. You can try along with euphornum, it will do good. And see, you have to check the see LH, FSH, and
Thank you.
prolactin, see prolactin, AMH. These are all you must check it out.
Thank you,
Progesterone.
Dr. Hariharan. We have two more hand raise. We'll go to Dr. Danesh and then to Dr. Shaji Kudiat.
Okay.
Good evening, Dr. ANUJA. It's really a very good session from you because, as rightly Dr. Hariharan and Dr. Ginny pointed out, you will definitely become an infertility specialist and, of course, a gynecologist. Because all these things are beautifully described, and how each remedy, each of the remedies can be differentiated from one to one another. That's also given. And this is what is lacking in most of the people. And sometimes people may have the right remedy in front, but they have a confusion whether to go with the right remedy or will have to go with some other medicines also. What about what's your opinion on this using organ remedies in during constitutional treatment? Whether you use any organ remedies specifically for these infertility cases?
Specific remedies you mean, doctor?
Yes, for example, you are treating a patient with pulsarilla, and you know that in the case of pulsarilla, she is having very large amount of leukorrhea with her. So in those conditions, whether you advise over 3x like that, or sometimes you may give some other tincture also. Whether you think in that line or not, this is what I
Very rarely. Very rarely.
very rarely.
Rarely I
Okay.
have given over test for very rarely, sir. And mother tinctures also very rarely I have given, because
Okay.
for fibroids I have given Fraxinus tincture. Other than fibroids, Helonius I have given for dislocation, I mean displacements, like. Other than these two remedies for female complaints, because these remedies have been working wonderfully these many years, so I didn't think of other remedies.
No.
Thank you,
Yes,
Dr.
and,
Danish. Now, Dr. Shaji Kudiyat.
Experience.
Dr. Shaji Kudiyat.
Yes, thank you. I am outside, so I will not open my video, but I wish to convey one important message to Dr. Tanuja and others who are listening this wonderful presentation. Dr. Anuja very nicely presented and made some important connectivity regarding infertility of the females, where she observed the increase in the testosterone level. So, is it right, doctor?
Sir, you're asking me, sir?
Yeah, is it
Yes,
you
sir.
mentioned?
Androgen,
Okay.
yes, sir, because
Yeah.
androgen, because in PCOD, the pathology or the clinical symptom, the picture which we get usually is hyperandrogenism. That is called HAIR-AN syndrome. Hyperandrogenism, insulin resistance, so acne
Yeah.
vulgaris, obesity,
You are
all these.
right. You are absolutely right. But I wish to connect these with some important developments happening in the world, around the world today, where we are forced to live in a different unnatural philosophical mind setup, where little controversial topic, but I wish to share this with you because there is truth in it. There is introduction of gender equality. This gender equality is totally changing our way of thinking and living. We used to study that men and women are different genetically, physically, physiologically, biologically, and psychologically. So we'll be able to live normally and healthily only when we live accordingly, because men and women are men and women, designed and destined to fulfill different purposes, missions and responsibilities in the world. So we all know that men and women differ genetically with the XY chromosome and XS chromosome. Physiologically, men are guided by the hormone testosterone, and women are guided by two female sex hormones, estrogen and progesterone. And biologically, the missions of women and men are different. Physically, we can see the differences in the physical sex organs, hair distribution, musculature, in different physical perspective. And psychologically also, we can see such a difference. So when we live accordingly only, we'll be able to live normally, and our physiology and functional capabilities will be healthily fulfilled and naturally. So these differences we need to observe, and you need to see the characteristics or behavior characteristics and thought philosophy of such people also from now onwards, and need to convert them, because that is part of homeopathic treatment in identifying and rectifying the fundamental causes that produce the problem, which we will not see in our obstetrics and gynecology textbooks nowadays. So it is also our part to understand the fundamental causes that produce the problem, help the patients realize it, so that they can restructure their mind setup, so that the vital force rectification we are doing by giving the right medicine will be sustained. Otherwise, if the wrong philosophy remain in our mind, as the mind is the most important influencer of our vital force through our thought vibrational frequencies, which can superpose and modify the vital force, and even though our medicine can rectify it, it can again go back to the previous abnormal state, and the unhealthy situation can recur. So for a permanent cure, Along with our medication, we need to identify and rectify the fundamental causes that produce the problem. That is an important mission that we homeopaths and all holistic systems of treatment doctors should fulfill. I am just bringing to your attention all these matters. From now onwards, you can check on these things too. Thank you.
Sure, sir. Sure, sir.
Thank you,
Definitely.
Dr.
Thank you.
Shaji Kudiyar. And now it is the time for the Malayalam session. And thank you so much from the beginning. Today's session, Hindi also, it's like a fireworks. And Dr. Anuja also like a firework. I don't know, today the guests we have got all are very energetic. And thank you so much for your class. Thank you so much. And now tomorrow we are celebrating our 1200 day. So we will have a session from 8. We will have a session from 8 to 9:30. Then only we'll continue our Malayalam session. So all of you have to join to celebrate our 1200 day, because we will have the purpose of IFPH is spread the knowledge of homeopathy to the entire world, and many participants from many parts of the world are joining tomorrow. So be a part of our celebration. Now we are already late for the Malayalam session for the next firework. So good night, everyone. And I'm welcoming Dr. Shaila for moderating Malayalam session. Welcome, Dr. Shaila.